Hello, I'm Abigail Marquez, the General Manager of the City of Los Angeles Community Investment for Families Department. Welcome to Pathways to Prosperity, a show that features programs and resources aimed to empower Angelenos. Today, we're at MacArthur Park, an iconic space that's recently received national attention, but has long been a place of refuge, resilience, and community for thousands of immigrants over the years. As a proud daughter of immigrants, I remember coming here as a child for concerts in the park, surrounded by music, family, and the vibrant culture that defines this neighborhood. We're here today to discuss how to connect immigrant Angelenos with the resources and the support they need, especially in a time of heightened economic hardship and uncertainty. We're honored to be joined by Councilmember Hernandez, who not only is a representative for District 1, which is really, we're here in MacArthur Park today, but has been an incredible champion for Angelenos across our great city, and has been even more so incredibly fierce and your advocacy to support our communities in this very difficult time that we're in. We're also joined by two incredible community advocates and leaders that are working every day to ensure that our communities stay informed and protected. We are joined today by Maegan Ortiz, who is the Executive Director of IDEPSCA. And Maegan, you're going to tell us what IDEPSCA means and what it does very soon. But you do operate 5 day labor centers in the city of Los Angeles. And we're also joined by Lena, the Director of Policy and Administrative Advocacy at Neighborhood Legal Services. Welcome to the two of you, and thank you for joining us. So I'm going to turn it over first to the council member to ask our first question to our panel.
Great, thank you. And welcome so much to MacArthur Park, Council District 1, a park that not too long ago, several weeks ago, was overrun by federal immigration agents with their horses and flags that later they made an Instagram video about being here, scaring our communities, kids. But now we are here. We are here as community organizers, as community advocates, as leaders, taking up space, reclaiming this space because it is ours, it is our communities. And so I welcome us to have this conversation about the incredible work that y'all are doing in a space that needs love and healing, and to remember that there's incredible work happening. So thanks again for having us today. But yeah, that's my question to you, Maegan.
Yeah, thank you so much, Council Member. I think LA has a lot to be proud of. Day labor centers and that whole model of day labor center was born here, right? It's a model that really looks at the worker as a whole person. And LA actually runs 7 day labor centers. You have 2 in your council district, right? And really what they are is they are community hubs. They're community hubs where workforce development happens, meaning job training, meaning a support in looking for jobs, but also even more important, especially in the context of what's happening now, it's also about making sure that workers, regardless of their immigration status, know that they have rights as workers, and making sure that they're educated so that they know how to enforce those rights, whether that be minimum wage, whether that be overtime, whether that be sick time, meal and rest, all of those important things that a lot of workers take for granted and that we know some workers unfortunately get taken advantage of. But I think especially, if we think about all the crises that have happened and that LA has survived together, whether it was the pandemic, whether it was the wildfires in January, right? The day labor centers really have also become community resilience hubs where families go to get food, where they can even get health care. We've done vaccine clinics. So they really are these safe, sacred spaces that the city has invested in for a really long time to support workers regardless of their immigration status and their families.
Thank you. And including wage theft, right? Sometimes, we expect a paycheck every time we go to work, but our day labor centers can't even count on that. And I know that you all help make sure that they get paid for the incredible work that they do.
Yeah, I mean, the first part is the education, so we don't have to deal with wage theft, but a lot of times that does happen, right, where workers are not getting what they're supposed to be, get paid. And I think, it was the day laborers and the fight for 15 and overtime, right, that helped start the city office of wage standards even, where workers can file those wage claims. And it helped create the LA Civil Rights Office to fight against discrimination.
Yes.
So I think all the centers, regardless of whether you're a member or not, a day laborer or not, if you come, we will support you through any wage claim process from beginning to end until you're able to get paid for that day's work that you deserve.
Thank you.
Thank you, Maegan. I really appreciate that you refer to the day labor centers as community hubs because they really are that. They are connecting individuals to a host of services that are available and should be accessible to everyone in our city. So I just want to lift up our department does also have a network of family source centers and really want to lift up the work that they're also doing. And I know that we've connected you in a more intentional way during this time to them to connect our day labor sites and the individuals working out of those sites to other services, other wraparound services. From June 7th to now, our family source centers have reached out and supported close to 5,000 unique households, and that is an increase from previous years. We shifted our model and we were able to get the state to approve the use of our resources to get grocery gift cards, over 165,000 in grocery gift cards, and a separate amount of close to 600,000 in emergency assistance that we made available to our families who are in crisis right now, that are suffering greater economic hardship. And I know, Lena, you're working exclusively or specifically you're working on the public charge issue and dispelling some of the misperceptions that are out there that immigrants are taking our public benefits. But there are a number of benefits that our immigrant Angelenos are still entitled to. They're still available to them. But there is this notion of public charge, and does that harm them down the road? Talk about what is a public charge, or what is the public charge, and talk about the work that you're doing to continue to connect our immigrant Angelenos to public benefits.
Thank you. I'd be happy to. Yeah, so one of the repercussions, the many repercussions of the deeper immigration enforcement and the fear that is being spread in communities is that immigrant communities were already hesitant and mistrusting of the public benefit system, and that mistrust is only heightened right now. So to answer your question specifically, what is public charge? As you said, there's a general understanding or fear in the community, immigrant community, that use of public benefits can harm your immigration status. And that comes from this immigration rule, public charge, which has been a part of the immigration system for many, many years, but there's been a lot of heightened focus on it. Actually, data shows that about 25% of eligible households avoid use of public benefits because of public charge. So education is really important, and it's a little bit complex to understand, but we do have a lot of resources on our website at bylanetwork.org, which is a project of Neighborhood Legal Services. But basically, public charge is an immigration rule that only comes into play when people who are living in the United States apply for a family-based petition for a green card. So we really want people to understand that it does not come into play in every immigration proceeding, and it also doesn't consider the use of every public benefit, only a few. So it's asking if the immigrant who put forth this family-based petition, this is to get a green card through a family member sponsoring you, it asks if this person might become dependent on the government in the future. And in looking at that, lots of factors are considered: your age, your education, disability, and only one factor is use of public benefits. And the only public benefits that are considered are cash benefits. So in LA, that would be SSI, GR, CAPI, and CalWORKs. It's only the immigrant's own use of those benefits, so a child's use of those benefits does not count, which is a critical change that happened in 2022. And the only other benefit is Medi-Cal, but only for long-term care, like being in a nursing home because you cannot care for yourself and you cannot return to your home. It's not rehab, it's long-term care. So yeah, I really encourage you to visit our website. The Byland Network is available for all residents of Los Angeles County to have an individualized public charge consultation, but we just want people to really focus that this is a narrow rule that's only applied in certain settings, and to always pause and before disenrolling from benefits or avoiding benefits for yourself or especially your citizen children, that you get the help you need to talk through that.
Thank you, Lena. And I know that if you can speak to some of the federal regulations that may be changing, those that you're challenging, or what we need to remind our Angelenos about right now, and what we're hopefully not having to put in place down the road, but some of the concerns that you're monitoring right now as it relates to public benefits.
There are a lot of changes happening. So I guess the message at the top is be connected to trusted sources of information. But the big critical message around public charge specifically is that nothing has changed under this current administration. So you stay connected with those trusted sources of information to learn about any changes to how use of public benefits can impact your immigration status specifically. That's what public charge is about. I think a little later we might talk a little bit more about some other things happening in terms of data privacy and actual changes to eligibility. Would you like me to answer those now?
You can, absolutely,
okay.
Please do.
That would be all of my answers. Okay, I could just keep going, y'all. Okay, let's do it. Okay, well, while it's good news, and we didn't expect this, but while it's good news that nothing in public charge has changed, there are no proposed changes there, there have been changes to public benefit eligibility at both the state and the federal level. So I'm going to focus on the state because that is something happening really soon. So we are proud to be in California, which is the first state to have expanded access to Medi-Cal, which is what we call Medicaid in California, to all people regardless of immigration status. And that was a long-term process of phasing in different age groups over, I think, about 15 years. Most recently, between 2020 and 2024, we expanded eligibility for Medi-Cal to everyone, okay? And we thought that would stay. And the state is in a budget crisis, and in this most recent budget that was passed, we have an enrollment freeze that is coming. January 1st, adults 19 and over who are not yet enrolled in Medi-Cal and were only eligible because of this expansion to people who are undocumented will not be able to enroll in Medi-Cal anymore. So it is a really important time to connect with BILA, connect with your source centers and your day labor centers, your schools, to get the resources you need to make the right decision for your family to enroll in benefits. There will also be a dental care freeze where people who are not federally funded for Medi-Cal, which there will be losses there beyond the Medi-Cal expansion, will not have access to dental care. So my message is use dental care now. Make sure you have a dentist. Make sure if you have dental care needs that you take care of them. You really take charge of that over the next few months. There's also potential losses to CalFresh. That is our state-funded, that's our state name for SNAP, for food assistance. Certain immigrants that have had eligibility for this benefit since 1996, the last time there were major changes to immigrant eligibility, they will be losing access to benefits. These are refugees, people who've already been granted refugee status, people already granted asylum, domestic violence survivors, trafficking survivors, and a few other categories. We're hopeful, though, that there may be changes at the state level that will bring those people into state-funded benefits. That's at both Medi-Cal and CalFresh, where we could see the state offer benefits under state funding for these folks. There's also changes, those populations will lose Medicare and lose ACA access. So there's so much, no one can memorize it. We're putting together a lot of really important resources on our website. You can reference it and there'll be links. So you may have to continuously, like me, revisit these timelines. Also, the timelines for all those changes are a little bit different.
Yeah, thank you. It
sorry.
is a lot. I really
It's
appreciate, no, I think I really appreciate the way that you laid out very succinctly the different changes that are happening. We will also have information. We're updating our website frequently to make sure that we're putting communication out that is still timely and relevant. But it's overwhelming. It's overwhelming to digest. It's overwhelming. I can only imagine for the individual or the family that's navigating all of these different changes that will directly impact their livelihood. So really appreciate all of the advocacy work that you're doing and the information sharing that I think is so incredibly critical for us to make sure that we're ahead of, because there's a lot of misinformation that is out there. So we will continue to update and monitor those changes as well.
Megan, I have a question for you now. How have the day labor community job centers been impacted in our current climate as immigrant families face fear and uncertainty because of the federal immigration enforcement raids?
Well, just like you opened up our session today, Council Member, the day labor centers, because of them being such a landmark part of Los Angeles, have also become targets. You know, we operate 5 out of the 7 day labor centers across the city, and 3 of them have had 12 raids over the last 3 months. We've had over 100 day laborers and street vendors taken from our organization, from our communities and their families. So the day labor centers are definitely feeling the impact. But I will say on the other side, right, one thing that is coming out of this, just like during the beginning days of the pandemic, is that it's also bringing people together. It's also has become centers where neighbors who maybe knew that there was a day labor community job center near them but didn't really know what it was about are coming in, or like, I live around the corner from here. What can I do to help? We're working with local businesses, and people are bringing food for volunteers. We've seen a lot more volunteers come, so that the workers who use these spaces every day and their families who use these spaces every day can continue to feel like, despite what's happening, despite the very clear targeted attacks, they're not going anywhere. And they're going to continue to be here to serve them and their families for as long as this goes on for and beyond. We've been through stuff before, right, as a city and as day labor centers. So I think reminding ourselves of that and really using it also as an opportunity to build a community. It's been tough, but day laborers, jornaleros are tougher.
100%. You're right, 2 day labor centers, one in the Home Depot in Cypress Park, which was one of the first places hit in June when this all started, and the Westlake Home Depot, which has been constantly hit, and most recently was hit with the Penske truck, Operation Trojan Horse, which, using, war language against our communities, just goes to show like what the vision they have for our communities. So thank you for uplifting that. And you're right, they are tougher. And Los Angeles continues to show its best side in a moment of crisis. So I appreciate you sharing that. Thank you. And Lena, now I have a question for you. Mm-hmm. Is it safe for Angelinos to share information with public agencies and to go to public places if they're worried about deportation? People are scared that their information, their addresses is going to be shared with the federal government, but also that the federal government is actively looking for this information. What can you share with folks about this?
Yeah, so this is a very tough time for that particular question. BILA has given, and Neighborhood Legal Services has given countless trainings, and where we share that your information is safe when you share it with DPSS or other government entities for the purposes of getting a government benefit or filing your taxes. But in the last few months, it has become clear that people's information is being targeted by the federal government when it's shared for the purpose of getting public benefits. So this is a very new time, and I will tell you the best that I can what information we can give to people to make the best decision for their family. So first, starting with Medi-Cal, with Medicaid, we learned in June that there was a information sharing agreement being formed between DHS and ICE, which is a sub-agency of DHS, and the Center for Medicare and Medicaid Services. The state routinely gives that information for the purpose of the federal funded aspect of benefits, and it has never been used before for anything other than benefit administration. So lawsuits have been filed, and while we're unsure exactly what happened over a few weeks before the lawsuit stopped the sharing of that information, there is currently a pause according to a court order in that information sharing. There was also a request from the federal government for SNAP data, which is CalFresh in California. That information is not routinely shared. The state would have to share that information, and to our knowledge, it has not been shared at this point. There was some escalation in that situation recently, and some threats by the federal government of withholding funding or sanctioning the state, and the Attorney General of our state and several other states did file a lawsuit there. There's no result there yet, no particular ruling, but again, to our knowledge, no information has been shared. And then another really critical benefit people rely on their tax return every year to bridge that gap. And people who are undocumented can get an ITIN, which is, tax ID. You don't need a social security number. The federal government depends on these billions of dollars in tax returns that fund our services. But yes, the federal administration also entered into a data sharing agreement with the IRS. There's a lawsuit there, and it has restricted the sharing only for specific circumstances where they're finding people's information who have a criminal conviction or final deportation orders. So narrower than what we know could be happening with Medi-Cal and potentially with SNAP, but still very harmful. So this undermines the whole system. So I told you about public charge and all the people who are not impacted and all the benefits that aren't impacted. All three of those benefits are not impacted by public charge, but now people could be scared to get them because their information could be there.
Lena, you mentioned the privacy issues related to just tax information and people who are maybe immigrants and or undocumented who are seeking to obtain an ITIN. I know that we do a lot of work during the tax season through our family source system to help connect people and help connect people to ITINs, help people file for free. This past year, we did connect people to $15 million in tax refunds, but it was a drop from the previous year, and that's because there's so much fear. So I really appreciate that you're clarifying the narrow scope where a person may potentially be impacted, what those risks are. I think this is another area where we need to continue to elevate and make sure that people are clear about what are those risks, what are the impacts. Want to come back and do more work around that as we get into the tax season next year to make sure that we have clear information out in the hands of residents that are taking advantage of these services. So thank you again for that. We're almost at the end, and I know that this is a beautiful day, but it is hot, so we're all bearing through this in the heat. I do have one final question for the two of you, and Maegan, we'll start with you. Both of you are doing, and the organizations and so many of our immigrant rights organizations are doing incredible work. You've been on the front lines responding and activating our rapid response networks. Have probably not slept more than a few hours every night and haven't stopped working consecutively for weeks and weeks now. What else can we do, or what can we do to support you in a way that we're currently not responding to this moment? I mean, we will continue to make sure that we are advocating for additional resources to make sure that we're lifting up information that is critical to get out to more and more Angelenos. But what else can be done? What else can government do, if that's okay to ask, Council Member, to support you in this critical moment?
Yeah, no, thank you for that great question. I think, and we saw it this last recent city budget cycle, right, when we saw communities really fighting for what was important in their neighborhoods, critical services. So I think making sure that we keep our eye on making sure that those critical services that include day labor centers, that include family source centers, right? Those are such incredible community spaces and such spaces of resilience, as I shared earlier. So making sure that those are fully funded is so important, because we need people there to support day laborers and household workers and their families. So I think that's a huge piece of it, right? And I think, as I shared, making sure it's really important that, yes, we defend our values as a city, and one of the ways we do that is by making sure that these services continue, and not letting the fear, right, shut us down, stop us from doing things. Sometimes with fear, we get ahead of ourselves and we do things ahead of time to, comply or just to protect ourselves, when actually we're doing ourselves and our community a disservice. So I think really leaning in to our values as a city and the amazing programs that have come out of this city and being really proud of them. So I think that's really one of the most critical things that could be done. We've survived worse things. We're going to survive this, right? All of us are here, I believe, because of our parents, our ancestors. They knew something, we know something, and we're going to keep it moving forward.
Thank you. Thank you for that, Maegan. Lena?
Yeah, thank you. Yeah, I think because things are moving so quickly and changing so frequently, no nonprofit alone or even group of nonprofits can make sure that there's trusted information that's reaching the whole community. So it's really to continue working with folks like Neighborhood Legal Services and the BILA Network and other organizations representing immigrants to have the most up-to-date information available through the city, through trusted spaces in the city. And we're very happy to continuously partner so that information is universally accessible and like really understanding the difference between advice, which we can't give when we don't have that relationship, and information, which is applicable to everyone. We call that legal information, and everyone can have access to that. It's just what the law is, and people then can apply it to themselves on their own time. So that's what we would say.
Thank you for saying that, Lena. I'm going to turn it over to the council member for some closing thoughts or remarks.
Sure. Thank you so much. Thank you for letting me join y'all today. Thank you for the incredible work that y'all are doing. Maegan, you know, the day laborers, the jornaleros are so lucky to have you as an advocate. You know, during the budget process, I worked alongside you, and even with everything that's happening, I see you're there every single day. And we are just lucky as a city to have you. Thank you for advocating so strongly for them. And Lena, it's my first time meeting you.
Nice to meet you.
But the information you have is what prevents someone from going to the doctor whether they're having heart issues or, you know, different bodily crises or emergencies, a root canal. Like you have the information that opens the door for people to feel safe to do that. And so I'm glad we're uplifting that here, and that information will be shared. And I'm saying these things because as a representative on the local government, I feel like we have a huge responsibility to step up at this time to meet our families, their needs holistically, right? Whether it's just doing the basics of making sure people have groceries or getting the resources they need so that they don't fall into this eviction to homelessness pipeline, or bringing partners together to have a health resource fair, to do the blood work checks, to do the different things that maybe folks are scared of doing. I say these things because it's a responsibility, and I welcome it. And as a city, we have to step up. And, you know, we have a budget that we decide every year. We decided this budget before we hit this crisis. Maybe it's time we look and how do we make sure that our dollars are going to our families, that are going to generate revenue that'll then go back to the city and keep families whole. So I'm thinking about all of it, and I'm just grateful to be able to have this conversation here with you in MacArthur Park, where if you look around, there's people enjoying this green space. They're here, they feel safe, their families are here. We need more of that, but also hold us to task, because every district has community that's impacted right now under these immigration raids. Every district has an economic engine that is thriving or not thriving right now because of the lack of immigrants or because of the incredible work that immigrants do. So I don't think we can turn away in this city. And so I commit myself to doing that work, and I commit to bringing other of my colleagues forward to do this work. I'm down to throw down. This is a really beautiful conversation, uplifting, incredible work.
I love hearing her say that she's down to throw down. Thank you again to Councilmember Hernandez for joining us today and for being an incredible champion for working families across the city of Los Angeles, and to our distinguished panel for joining us today and for the tireless commitment that you have not just demonstrated in this incredible moment of our history that we're in, but for all of the work that you do every day for our communities. And for more information about the resources that were discussed today, please visit our website,